Nothing is more important than family and healthcare. Today we're announcing $125 million for more cancer research. We're here at the Avner Institute because pancreatic cancer is such a challenging cancer. We're here because we want to provide $20 million to help reinforce the marvellous work they're doing here. We've got the world's best researchers. We should have the world's best funded research. We should make sure that we give the world's best researchers the tools they need to help beat cancer.
We're also here with Caroline from the Avner Cancer Foundation. Pancreatic cancer is just one of those awful cancers. It's no good cancer. They're all bad. But this is such a sneaky cancer. Some 3,200 people will be diagnosed, and only 10%, less than 10% of them survive after 5 years. It's a cancer that hides. It's a cancer that uses your own cells to actually hide from chemotherapy, and it's resistant to many of the new immunotherapy drugs and the standard treatments. And we've not had enough money in research. So I'm very proud, as part of our $2.3 billion Medicare Cancer Plan, to be investing $125 million in addition to what comes out of the Medical Research Future Fund or the NHMRC. This is additional $125 million for cancer research, and $20 million to help the Avner Pancreatic Cancer Foundation really start to turbocharge research in this area, because these people, these beautiful people, Susie and Paul, who we've met today, and the many people I've known who've passed away with pancreatic cancer, can't wait. They need this research today. I'm really proud to introduce Carolyn today, who lost her beautiful husband, Avner, 10 years ago from pancreatic cancer. And she's turned what has been an awful family experience into trying to fight for the so many patients that we lose each year from pancreatic cancer. Caroline.
Thank you all. Pancreatic cancer is a particularly horrific form of cancer. Less than 10% survive till 5 years, and for 80% of patients diagnosed, they'll be lucky to see 12 months. It is the cancer of our generation and needs to be fixed. We can see from other forms of cancer, such as breast cancer and prostate cancer, that with research funding, those stats can change. Both those forms of cancer have 5-year survival rates of 90% and higher. We know that this can also happen for pancreatic cancer. My husband, Avner, died in 2008. He was one of 3,000 people who died back then. And every year since then, those similar kind of numbers have died. We really applaud and are so sincerely grateful for this great decision by the ALP to invest in pancreatic cancer research. I know that all the families I meet across the country who've been affected by it, who've lost loved ones in as soon as a few days, will really be so thrilled and that there's finally some hope for the disease. And I'd just like to say a personal thank you for this decision. Thank you.
Thanks, Caroline.